Hi, there's a reason why I recommend this, olive oil, over Ozempic for my coaching clients who are trying to lose weight. Let me put this down. In a traditional clinical setting, it's kind of frowned upon to badmouth prescription medication. I think many of you have an idea of where I'm coming from. I won't explore that any further, but let's contrast Ozempic and olive oil. Let me first start by saying many people do just fine with Ozempic and other GLP-1 type medications, technically peptides, but many people also do horribly with them. So it's not uncommon for patients to report to me severe abdominal pain, rectal bleeding, feeling like they're going to faint or pass out, horrible acid reflux, and muscle wasting. Muscle wasting is actually very common, and when people lose weight on these type of medications, much of it is actually the deterioration of muscle. And the sad part is, one of the key indicators for longevity, living long and healthy, is muscle strength. So if you remember that old commercial, "Help, I've fallen and I can't get up," that is somebody who will likely not live much longer after that fall. But if you have an elderly person who falls, who happens to be more robust and has more muscle strength, very likely they will recover better from that and live longer. To understand Ozempic, you need to understand GLP-1. And GLP-1 is a hormone that's made in your GI system. Everything from your mouth to your butt where food and drink passes through. I try to make things super simple. I don't do deep dives because I want the layman to understand it. If you understand the information, you can use it to your benefit. GLP-1 is a peptide or a hormone released when you eat food. And what it does is it helps control blood sugar. It gives a signal that you're full. It delays gastric emptying. And what is gastric emptying? It means the food in your stomach and intestines is moving along at a certain speed and it slows it down so it doesn't get out too fast. Okay, and it also helps release insulin. So the thing about GLP-1 is the half-life is very short. It lasts about 1 to 2 minutes before another enzyme breaks it down. Not a big deal if you're living healthy, but if you are living a modern American lifestyle, eating a modern American diet, that's problematic for you, because those signals just don't last long enough and they're not strong enough to keep up with all the garbage we're putting into our bodies. Enter Ozempic. Some guy in Canada, a doctor, was doing research 10, 20 years ago and found that the Gila monster lizard contained a version of GLP-1 in its venom, in its saliva. But the version that the lizard had was something like 200% stronger than what humans made. So instead of lasting 1 to 2 minutes, this can last up to 2 hours. You get all those positive signals for up to 2 hours long. So they took that chemical structure and recreated a synthetic form of it in the lab, put it in an injector pen, and now you have Ozempic and similar medications to Ozempic. The problem again is some people do horribly on Ozempic. Now let's talk about olive oil. The cool thing about olive oil is rather than acting like Ozempic and lasting 1 to 2 hours, what it does is it exponentially amplifies your own version of GLP-1. So you just get a ton of the GLP-1 that you make in your body. So let me bring you to the storyboard and tell you what I'm talking about. All right, everybody, you're just gonna have to deal with the glare, sorry. Okay, so hunger is a dragon and we have an emo dragon. Nobody understands me, my life sucks. All right, and when the dragon strikes, you get hungry and you feed it, and sometimes we're just not equipped to handle this diet, so the dragon comes back even stronger. So the village sends out a couple peasants to fight the dragon. That's normal GLP-1. But the peasants don't really stand a chance against this dragon here. Maybe it would have worked better if I named this dragon the modern American diet, but too late, we're here. Okay, so the peasants get sent out by the village and they get wiped away. The second option would be to use Ozempic. Rather than sending out peasants, you send out warriors, people who are trained to fight this dragon, and they do pretty well. But like I said, some people don't do well on Ozempic and they have horrible side effects. Our third option, what I believe to be the healthier option, is this: olive oil. Send out the crazy ass mob. Okay, so the village no longer just sends out a couple of peasants. Instead, it sends out the whole town, and you have thousands of villagers coming out to attack this dragon. So just a quick review, the peasants last about 1 to 2 minutes. The warriors last about 1 to 2 hours. But with olive oil, those peasants will send out a larger force like the whole town, and even though they only last about 1 to 2 minutes, again, that half-life before another enzyme breaks down the GLP-1, it doesn't matter because you have so many of them. and it's like a colony of ants just destroying a larger insect. If you ever seen that, you know how devastating it is. And that's what olive oil does for the GLP-1 that we produce naturally without prescription medication. So pour that stuff all over your food, and I'm being hyperbolic, use it reasonably, but use it, and reap the benefits. Okay, that is my super simple breakdown of Ozempic, GLP-1, and olive oil. It can get really complex, but I don't want to make it complex here. I want it to be simple so that you can use this and benefit from it. That's all for today. Have a good one.